processes that would bring respiratory symptoms to us. But we struggled with understanding this booger, and I think we still because of the rapidity with which this has unwound itself, we don't understand. We don't have all the answers, right? This isn't a well-studied disease. This we've changed and adapted to everything as it has happened in real time. And this is a little bit unnerving for healthcare workers. We like to know the science. We like to know how we're supposed to react to things. We like to know how to protect ourselves. We like to know all of those things. We like to know what drugs work. We like to know how best treat patients, we like to study the studies. We like evidence-based medicine, and we have none of that with this particular pandemic, at least not to the extent that we would like. Now, I say that in 6 weeks, I have never seen the depth and breadth of publications, of collaboration, of participation across all specialty areas, across all kinds of healthcare workers and healthcare initiatives, working with partners. I have never seen things work so fast and so well without barriers, and barriers are just dropping like flies. If there was a governmental barrier, it's not a barrier anymore. If there was a corporate barrier, it's not a barrier anymore. I mean, so many things are so different than they were 6 weeks ago. But all of this has been us out of our comfort zone. But what did we do that first 6 weeks? We really we prepared for the worst is what we did. We prepared surge plans that we had in the back of our minds and we're actually working for along the lines of Cascadia. We were more prepared for trauma-based surge plans, but we flipped those very rapidly to infectious disease surge plans. We adapted specifically to COVID and to respiratory type initiatives. And we've refined and refined and refined how we use personal protective equipment. We've refined how we do testing and who we test as more and more testing has become available. We have refined policies and procedures. We have spent our time working with our partners and trying to figure out how to handle this on the front end. And now, finally, over the last couple of weeks, because of a lot of good news, because of a lot of very proactive members of our county and our region, we are starting conversations with our partners about what recovery might look like. And I think we're well ahead of some other states, most definitely, and other parts of our region, assuredly as well. So we feel like we spent our time wisely. It has been a flurry. We have this joke, we don't even know what day it is anymore because every day is like every other day. It's just you jump in and you work as hard as you can and you figure out innovative ways to do things that you've never had to do before. You figure out how to make a meeting happen with people across the state or across the city or, whatever you need to do. You figure it out and then you break down those barriers and you make some magic happen. Some of the things that I can just bring you up to speed. There's probably those of you who follow this like crazy, but we are so lucky in our county that we only have 4 positive COVID tests, and none of those have been hospitalized in our county anyway. We've had no positive COVID tests result from within our hospitals. And we've had, a sort of stalling. We haven't seen those go up in about a week. So we really feel very fortunate because there are other parts of this country and certainly other parts of our state that are not this fortunate. Across Oregon, for example, as of, this was actually yesterday morning's information, we had 1,663 positive cases, 31,688 negative cases, and a total tested of 33,351 and 58 total deaths. And again, we've been very lucky in Lincoln County that we have had any deaths. In fact, in our tri-county area that we operate in Lynn, Benton, and Lincoln County, we've only had 12 symptomatic patients in our hospitals with that tested COVID positive, and those have been in our Corvallis location and our Albany location. So none of our smaller hospitals have had any inpatients, and I would hope that would continue to be the case, and we would definitely be on the right track. We are when we talk about recovery now, and I don't want to overlook those folks who have a lot of questions about what is still going on, but it is important to understand when we look at recovery, both for healthcare and for our economy. And I think it's very important to think about this. We've got to have the right timing, and we've got to have the right pieces in place to make it safe for everybody, because we can't just open the locked gates, especially in a vacation area, to just have people flood in, especially symptomatic people who, who would bring the disease with them. We have to be very careful. So it is important that we have both testing and contact tracking in place solidly before we do any sort of opening of healthcare, further opening of healthcare, or further opening of the economy. And we are taking this upon ourselves, as this is our part of the healthcare system, both with public health and with being basically the only people doing any significant testing, in our counties. We have to lead this, and so we are absolutely expanding our testing at every corner. I cannot tell you a week that has gone by when our testing strategy has not changed for the positive. And right now, we made the positive change over to Legacy Labs. Previously, we had used Quest, we have used University of Washington, we've used the Oregon State Lab. We have used just about anybody who would let us send a sample to them. And we are now solidly with Legacy Labs. And they are able to do turnarounds for us in 24 to 36 hours at the outlying. And that is very different than we've seen before. We've seen turnaround times as large as 10 to 14 days earlier in the pandemic. So this is great. Because of this, it's enabled us to open up our testing criteria. So it's not just the people who are symptomatic and fall into the most narrow categories. Now we can broaden some of those recommendations. Especially, we want to make sure that anybody who's in a group home or any type of place where people live close together in groups, that they absolutely get tested. If even there's a sliver of a chance that any of them have it, we need to jump on that. We need to make sure that we're protecting all of our high-risk patients, even some asymptomatic people. And those are coming in the categories of if you need surgery. And some people, we're getting to the point where we stopped all elective surgeries. We stopped anything that was not urgent or emergent. But some of those urgencies and emergencies are coming around. And so we are definitely making policies and procedures to test and make sure we keep people safe, because that's part of opening healthcare back up too, is making sure that people feel safe when they come to a healthcare facility and know that we are protecting them and making sure that everyone who comes in that we can verify is COVID negative. And then as far as contact tracking, I will say that our public health folks are at a disadvantage. There's not a whole lot of them, and there's a whole lot of us. And we've got to figure out how to have enough workforce in place in case when we start opening things back up, if there's outbreaks that happen, that we can jump on it, figure out, who's got it, who needs to be quarantined, who needs to be locked down, and stop it in its tracks, because we cannot have things go in the opposite direction. We need to keep our good fortune. So we have offered across Samaritan our physician workforce who are residents. We have a large resident workforce. We have 5 residency programs. So these are all physicians, but their learning is sort of in limbo right now. And so they want to be a part, they want to be on the front line. So we have offered them as resources to public health for contact tracking and for resources to get us restarted when the time is right. When we take a look at the studies, when we take a look at the forecast, when we feel like we're really over our peak, when we feel that it is safe to consider opening back up, we want to have all of these resources in place. And I should add PPE. That's a big one too. We've got to have enough of our protective equipment to take care of any additional patients, or as we start opening healthcare up, we're not going back to the way it was. We're with it. This COVID is with us for a year, 2 years, whatever it is. And we're going to have to protect ourselves and our patients. So that means having plenty of personal protective equipment to continue to do so. And again, we're very lucky. Shipments have restarted from China. We are recipients of an outpouring of community support. We have enough personal protective equipment to consider doing this. And that's a big plus as well, because we could very easily be in a different boat. So why don't I stop there and see if there are some questions that anybody has.
Okay, there are some questions in the chat box. David, yours is kind of long. Do you want to just ask that yourself?
Well, my question's long because I listed the criteria that the governor had announced for beginning to remove some of the restrictions.
Yeah.
And my question's pretty simple: is given that list, how do we fare here in Lincoln County? Where do we stand in terms of accomplishing the things that the governor says have to happen before she can begin to remove restrictions?
Yeah, and I apologize, I do not have the chat up, so let me see if I can get that and look at your list. Yeah, so we talked about
the list is she
yeah.
had 5 points: slowing the growth of positive cases, having enough PPE, increasing testing capacity, and quarantining people who test positive, and tracking contacts. Those
Yeah.
were some of the things that she rattled off.
Yeah. So, and those are all the things that that I think we are addressing. The testing, the PPE we already talked about, the contact tracking and quarantine, and then it being the right time. Right? We've got to be at the right place on that virus curve, because if we go too soon, we're just going to slide backwards, and we're going to lose all of the advantages that we've had, going forward. So yeah, the time is not now, but we anticipate we have about a month to 6 weeks to get our act in gear. And then we'll be able to slowly start putting some of this in play. Again, if we feel the time is right, because we're playing this game that's by day, right? And we just have to make sure that, and not set false expectations and say, oh, this day is going to be the day. No, maybe we'll look at that day and see, but all of that needs to fall into place. And one thing that we've interpreted, and David, I'd love to hear your view on this. We've interpreted her words to have some flexibility by region, and meaning if we as the Lynn Benton Lincoln sort of consortium, if we can show that we're ready to go and that we have all of these things in place and that we can do for ourselves, we might have some advantage in being able to get some things going where some other places might not, if they don't have the same things in place. And so we're very much interpreting her words to mean not that somebody else is going to make all this magic happen, but that this is on us to make this magic happen. If it's within our power to do so, we need to be the ones leading the way so that we're positioned when the time is right, so that she can say yes to us, so that she can say, hey, you guys, you've got everything ready. Now we can go.
Well, I know there's other questions in the queue, but let me take a moment with that, because we are caught in a vice right now. That vice is, on one hand, trying to stay safe, stay healthy, and stem the spread of this horrible disease. And on the other hand, we've got the economic consequences and growing pressure to reopen our businesses and put people back to work during this critical summer season. Those are the competing pressures that we're experiencing right here in Lincoln County. And oh, by the way, I got a report earlier this morning showing that Lincoln County has the highest unemployment rate in the state right now. So all that being said, the governor is telling us that she's willing to consider opening up different regions of the state at different times. That's what you're talking about, the geographic consideration. And the problem is that if we reopen here, because we have stabilized and because we don't have new cases, does that suddenly send out a message that all those people in areas where the positives are higher and the disease is more prevalent are going to come over to the coast and vacation here and spend money here, but also spread risk here? So it's a very, very delicate balancing process where it's not enough to say we're going to open up because we don't have any cases. If we open up, then more people are going to come here and maybe bring cases with them. So we need to look very carefully at what we open up and when we open it up. And if we're doing well, maybe we can begin to do some of those procedures that you put off. And I know that putting off those non-essential procedures is costing our hospitals a boatload of money and creating some long-term financial concerns, but maybe we can do that before we start making decisions about opening up our gift shops and our retail stores and our hotels. It's not an all or nothing proposition, but I did want to raise that question. Just because we're doing well doesn't mean that we just simply remove the restrictions, because then lots of people are going to come over here and we may suddenly get that spike that we've been trying to avoid.
Absolutely. I could not agree more that we should just stop thinking about everything going back to normal, what was before, because it's not going to be normal for a long, long time. And so we've got to be very careful and very thoughtful about how we reverse what we've done. And I think that the most thoughtful thing we can do is to not just open everything, to be very selective and very careful and do things in a stepwise fashion. And again, know where we are on this curve and know that when we do something, we have a pretty good idea of what the outcome's going to be, so we don't get caught in errors. So yeah, I'm just trying to demonstrate that we feel like we've got a big role to play in getting us ready. And I don't want anyone to ever look at Samaritan and say, you're the reason we couldn't go when it was the right time. We want to be ready, but we're not, it's got to be the right time. And everybody has to agree. I think that's the important part is that we all, our elected officials, the folks in healthcare, the folks in public health, the folks that have to deal you know, with the bad outcomes, if there are going to be any. We all need to be in lockstep when we start to unwind this.
All right, so Misty Lamprecht has the next question, and feel free to step in here, Misty, if you have any additional questions. But her question is, what is the plan to handle the huge influx when routine care and non-emergency care is open? And will they prioritize those that had appointments canceled at the beginning of the shutdown?
Yeah, so great question. So the very first thing is, you may not be aware, but if you haven't had something sort of more urgent, but we never totally shut down. We have switched to a lot of telemedicine, meaning that we're doing the same thing we're doing now, but between our clinicians and our patients. And we can do this telephonically. We can do this in, you know, full audio and video. We can do this over MyChart with e-visits. We have a lot of different ways that we are doing this. So we are trying to maintain touch with patients and trying to make sure that those people who have urgencies or emergencies are getting care despite, you know, the shutdown. We are bringing people into our offices if we have to. You know, we don't take that casually, but there are those people that it's just right, and we do need to lay hands on them, and we do need to make sure they're safe, and the safest way to do that is to bring them in. Right now, our telehealth visits have now outpaced our in-person visits, and that is a shift that we have seen so very rapidly. Oh my God, over a month. It's crazy that we did that shift that fast. And right now we have seen our video and audio, which is of course the richest way to have this sort of telehealth. We've seen that now outpace our telephonic appointments. So that is ongoing, and we'll continue to push that. I will make a prediction here that, and I hope to God this is true, that we never go back, because there are types of care that are right to be delivered via telehealth. Just checking on you after we change medications. Hey, are you okay? Did this work for you? Why do patients ever just have to come back into the office for that? You know, there are just things that are going to be better served by this. The other thing that we hope is that in dealing with what we're thinking about is enhanced demand. The longer this goes on, the more demand for healthcare is out there. We need to do a number of different things. Number one, we need to be prepared to handle the additional demand. And with that will come a balancing act of making sure that patients feel safe and understand that they are safe because we are making them safe, you know, in our institutions. Because there's probably a lot of people out there, and you know, I would think, that are worried about coming into a healthcare institution. I don't want to go where there are sick people if I don't have to. And so how are we going to make sure that they understand the links that we're going to go to keep them safe? And so we need that to be a part of everything as well. But this demand, how are we going to satisfy the demand? So we are starting discussions with our clinicians right now about what we perceive is going to be increased demand, at least in the beginning, to get caught up, and how we need to transform ourselves. And this is just such a great opportunity. And I hate to say that I've been waiting for this opportunity for a long time, but I have. I never let a good pandemic go to waste, because this is making us better. And so we're going to be instituting after hours things, weekend things. You're not going to see healthcare just go back to the way it was. This gives us reason and purpose to be more of what our patients need us to be. And as they get back to work, as you know, recovery happens in the future, whenever that future is, they are going to need us to deliver healthcare when it's convenient for them. And so that is what we are starting discussions about. How are we going to do this differently? We cannot be a Monday through Friday, 8 to 5 entity anymore. This is it. We are done. We cannot be just an in-person entity anymore. We have to incorporate telehealth and everything else. You know, you bring the patients to you when it's appropriate, but every other time, you know, let's celebrate this and celebrate the changes that we can implement this fast now to our healthcare system. Now, key to all of this will be that some of the barriers that were there before, like some stubbornness from our government to pay us for, you know, telehealth visits and things like that, not go back to the way they were. And I think that will be the case, because again, COVID's going to be around an awful long time. And so this is going to be part of things in our armamentarium that we can whip out, and you know, telehealth is one of those. So I don't think it's going to go away. I think it's going to stay with us and be a big part of how we deliver care in the future. But yeah, it really is the care delivery changing up, being different. It is knowing that we have to have expanded hours and expanded services. We're also looking at what workforce changes that may entail, because right now, as we're trying to be super conservative with our workforce, the future may not dictate that, and we might need additional people to deliver care. So all of this is in the mix. So thanks, Misty, for that question.
All right, thanks for that answer. The next question is from Kathy Davis. She says, we have seen and heard of neighbors and people in Lincoln City and Newport who are ill but are writing it out at home because they are told they cannot get tested unless they're very ill or they're older and afraid to go to the hospital. She says, I have a background as an RN, 30 plus years, and don't feel the positive number of 4 cases is accurate. Also, social distancing is not happening in the general public as we go out to shop, nor are many masks worn currently. Will antibody testing be coming to our county to determine who has immunity?
Boy, that is a multifactorial question.
Yeah.
So let me go back and start with the testing thing. I completely agree with you. We have always needed enhanced testing capability. And it is unfortunate that we are just now building our capacity to be able to test more people. And even now, it's not just open. It is unfortunate, but it is the world that we're living in. And so it was not a deliberate thing to say, oh, you know, we want to be mean and you can't be tested. It was literally, we only have this many tests and we only have a lab that can turn around this many. Who is in the most need? And so that fell to our inpatients and to people who were in very high risk groups. People like our first responders, people who have lots of risk factors and you know, reasons to you know, such as advanced age, to be at to sort of have a potentially worse outcome. So I'm very happy to see now, just this week alone, we've broadened our criteria for testing. And I think you will see that occur more and more and more. Like as our capacity increases, then now we're opening up testing to even more people. And so, so unfortunately, it is a rationing situation, so to speak, you know, with the worst folks, the highest risk folks being the ones we're prioritizing for. But I truly hope that our future will be very different as things come online. One thing I didn't mention was we are looking at our own ability to test, and we should have a Samaritan testing facility up and running in another couple weeks, and that will be out of Albany to start. We'll have to ramp that up, so we'll still be using outside labs and But again, every little bit helps, right? Every lab that comes online, every time we expand our testing materials, every time we expand our testing media, every time we get more wiggle room to do all those tests that need to be done, we can alter that testing criteria. So I think you're exactly right. I mean, ultimately, it's probably not an accurate number, as accurate as we'd like to see, simply because there are those people who are writing it out at home. We just hope that they're being careful. And like you said, though, there are those people who do not socially distance, although I have been very pleased in my short forays out, my once a week grocery shopping, that I have seen some people being very thoughtful and very appropriate. So I think, you know, people will be people, and we just have to hope the majority are doing the right thing. I will say that there's some official data out there as well on our compliance that is done by county. And Lincoln has one of the highest compliance ratings of counties in the state. And I'm not sure how they get this information. I was like, wow, are they flying drones around? Who knows how compliant we're being? But that is some of the data. So there are many worse places, I should say. As far as antibody testing, we have heard a lot about it, but that is not going to be something that is going to be in play probably by the time we start to see some recovery efforts. So, you know, you can tell how long it's taken us to ramp up and get going with just the normal, you know, COVID-19 positive negative testing, you know, that's a PCR sort of thing. To ramp up antibody testing would be the same sort of process all over again. And so, so while it may have a role in our distant future, and maybe it has a role in vaccine development and possibly even treatment, plasma treatments of folks who have positive antibodies against COVID is definitely showing up in the literature now. It's probably not going to be a meaningful part of a recovery effort in the short term. So it's unfortunate.
All right. Another question from Joy Wilson. She says, when will the testing and tracing begin, and is it for everyone? And then a follow-up question, do you have any information on current progress on the vaccine?
Yeah, so as we mentioned before, every, you know, now week or so, I'm hoping we'll see expansion of categories of folks who can be tested. And again, it's not to say no to anyone. It is to say we only have so much. So who are the worst affected, the most affected folks that we need to make sure get those tests? And so my hope is that every week we sort of see this open up and broaden up to the point that if you have symptoms and want to be tested, then, you know, that is just a forthcoming thing. And there's room to move there. I wish I could tell you when this might happen, but things are happening pretty fast now. And so I'm hoping that we really have a lot more meaningful testing going on. I mean, again, we're a state of over 4 million, and we've tested 33,000. A little over 33,000 in the past 6 weeks, and that's just not good enough. And so we're going to have to continue to expand that capacity. And remind me again, what was the second part of the question?
Just the vaccine, I think.
Oh, the vaccine, that's right. That. Vaccine, hello. So yes, a very important question. When is the vaccine coming? Well, part of the problem with the vaccine development is of course, the regulatory environment and the hoops and whistles that we have to go through to make sure it's safe, because we all know that if it's not, that is not cool. And there are those people who, you know, will have a problem and issue with any sort of vaccine anyway. That being said, a lot of regulatory sort of things are dropping out of the way, things that were barriers. We also have companies and countries working together in ways they've never done before. I have never seen collaboration, because they would never permit it, you know, between big pharma, you know, this company and this company working together on a vaccine. Really? No, that never happened before. And we are seeing it now. And I have heard interviews with some of these virologists and epidemiologists and you know, scientists who are working for these companies and saying, this is unprecedented. We have never been allowed to share our research openly like this and to collaborate like this. And I think maybe what we're seeing is a realization that when we do develop a vaccine, that we will need everybody's participation in the manufacture, the distribution, and the administration of these vaccines across millions and millions and millions and millions of people. And so I cannot help but think that is the reason that everyone has come to that there's enough of this pie to go around for everybody. And we've just got to get to a vaccine as soon as we can. Initially, when we first started with this, I was hearing reports that it will be years before a vaccine would be ready by the regulatory standards of previously. Now I'm hearing months instead. So I don't know what that really looks like. I don't know if months are within this year, or if months are the beginning of next year, or, you know, how fast this can happen. I'm sorry, I'm not that in the know there, but I am just very pleasantly surprised at the progress.
All right, before we leave the COVID conversation, does anybody else have any questions? Not seeing any. All right, so can you talk a little bit about kind of what's going on at the hospital? I know we've had a lot of changes, both Newport and Lincoln City, and thank goodness, you know, that you were able to get open before this hit, but kind of walk us through kind of the timeline.
Yeah, absolutely. So, so boy, talk about a timeline, right? We got firmly into both North Lincoln and Newport, the remodeled portion of the hospital, within the month of COVID coming out. In the situation with Newport, it was actually the week before we got firmly moved in, and the last two things we moved in were the pharmacy and lab. And oh my God, thank God, right? We are in such a better position to be able to care for whatever comes our way, COVID and everything else in our new facilities. They are built for not only for surge, because we built that in, we know where we live, surge happens, you know, even on a normal, you know, summer afternoon for us, but they enable us to do things that we're, you know, comparing notes with our sister hospitals in the Valley, and we are so better set up because we have newer facilities. Crazy things like we can change the air pressure in our rooms down to the individual rooms. So as many of you may be aware, we want negative pressure rooms for COVID patients, making sure that the germs, the droplets, if we have an aerosolizing procedure, those things do not get outside of the room. So to have that flexibility, and I'm talking down even to our dirty utility rooms, we can use those. And everybody was like, well, what do we do with the dirty utility? You know, what? I was like, put the sheets in the hallway if we need to. By God, we're using that room. But we never had that level of flexibility in our other you know, situations. And that has allowed us to create robust surge plans where we can care for people in alternative and sometimes really bizarre locations, but we can give them as good or better care than they would have had in our old hospitals. And so it's really it could not have come at a better time for us to be super prepared. The other things that have been really a blessing are the rollback of restrictions for things like alternative care locations. We can set up those tents outside, and by God, we have. If you've been watching the front of our hospitals at all, you will see they're becoming like little cities of tents in some cases. And this has just enabled us to prepare. Hey, how do we make sure that we can identify a respiratory patient right up front, that we can get them to the right place, that we can keep them from infecting non-respiratory patients, and that we can do so very safely. And so in some cases, we needed to expand the space basically that we were seeing patients in even outside the facility. And so we're very lucky that some of those regulations have changed and we are able to do that. So some of the other things you've seen is us try to make things as safe for people who do have to come into our hospital as possible. So in the case at North Lincoln, we moved the lab for outpatient labs into an outpatient clinic building. And you'd say, well, why are you doing that? Well, because we have all those respiratory patients coming into our ER and being placed on, you know, in our inpatient area. And although we have never had a cleaner facility than we do right now, oh my gosh, I cannot tell you the amount of cleaning that is going on at a moment by moment basis. But regardless, if someone doesn't have respiratory symptoms and they just need to come to us for a lab, why are we taking them through there? And so, you know, our answer is we're not. And so outpatient testing facilities for asymptomatic people are just in a different location. Likewise, for our obstetric patients, that's another population we're worried about, right? They have the potential for becoming immunocompromised, and we still don't fully understand the role of COVID in a pregnant patient and on an unborn child. So we want to keep those as safe as possible. So we have set up ways to do ultrasounds outside of the hospital. And so, you know, we're just constantly looking for ways to do things in those sort of manners and keep patients and ourselves, frankly, safer and safer. So, so yeah, those are just a handful of the things that are happening at our hospitals. We continue to put the final stamps on our surge planning, all of those details down to what we even have IV pumps and like where they'll be located in the room. We have methods for having lengthy IV tubing so that we can actually change out IV bags and stuff outside the room. So we don't even have to gown and glove up to go into the room. We're coming up with innovative ways to make ventilators do more for us than they ever have. And we are coming up with such innovative ways to use ventilators we've never even used. We've commandeered some home ventilators that we have never had in our hospitals before, but they will be fine for some patients who have a moderate ventilator need, not a heavy duty ventilator need. And so we have gotten some of those rentals and are experimenting with them, making sure all our pieces and parts work. And we've engaged in some cross training like you would not believe, because we just don't know what the future is going to hold for us. So our clinic physicians now have been cross-trained to work in the ER or the ICU or med surg based on their backgrounds. And they are loving it. I think, honestly, we're creating intubation teams. We're creating ventilator management teams. We're cross-training people who've never had skill sets before. We're making sure they do have skill sets, because the scariest thing, I think, for us is if our workforce got sick, and who would then take care of patients. And so we need to make sure that we're as facile as we can be. And so we have all of those sorts of things ongoing and in place in a lot of cases. So I will talk forever, but maybe somebody else wants to know something else.
Well, just quickly, I was on a call earlier today with the Oregon State Chamber, and one of the McMinnville Chamber executive mentioned that they have a company that is making surgical grade masks. So I don't know if you have a need for that, or, you know, it might be a resource down the road.
Yeah, absolutely. I'll tell you what, we have gotten some amazing new ways to use PPE, and I shouldn't say use PPE, but like develop relationships with folks who can create this for us. And so, so in addition to the donations that have poured in, by the way, and I cannot thank our community enough for taking care of us. But for example, the cloth mask we cannot use in a clinical setting at this point. And I say at this point, if things got desperate, we'd use whatever we had. But ideally, the recommendation is to use either an N95 respirator mask or a positive air pressure full hood whenever we're dealing with COVID patients with different types of procedures that can create aerosols. Other than that, we can wear surgical grade masks that, of course, have you know, the correct materials and the correct fitting to make sure that we get the best protection. And then outside of patient care areas, which we have tons of, we can wear our cloth masks, and we have those distributed as well. But we have forged alliances with everything from our 3D printing community that is awesome, from the Lincoln County School District and OCCC. They have printed us hundreds now of permanent reusable sort of face shields, and those can be cleaned and reused as opposed to the ones that were disposable before. We have new ways, new manufacturers of gowns for us, and that is amazing and wonderful. And we have come up with different relationships with some of our vendors to actually to clean our dirty PPE, and in particular our N95 respirator masks. There are 2 companies now that I know of anyway, that have been passed by the FDA to actually I'm trying to think of the exact word they use, but you know, it's to clean and sterilize the respirator masks so that we can take those back into our inventory and safely use those again. And that has not even been a thing in the past. So so this is just it is sort of amazing to see just everybody pulling together and everybody figuring out ways to keep us safe. And it's from every branch and thought process, everybody from sewing at home to 3D printing to, of course, you know, out in Redmond, reprocessing our masks. So we are just enormously grateful and very lucky.
All right, thank you very much. So one last question, what can we do? What do you need from the community? How can we help?
Well, I think the biggest thing right now is to do what we're asked to do, you know, which is continue to sort of self-isolate, shelter in place, whatever we want to call it, you know, to make sure that we're not a part of the problem, that we're not spreading the virus ourselves. We've created a different story. Our story was not supposed to unfold like this. Our virus curve said we would be in the middle of a surge right now that would exceed the capacity of our hospitals and our ventilator supplies, our PPE supplies, and everything else to deal with. And yet we are here today, and we are talking about a very different scenario. And that is because we have done what's been asked of us. That has not been by accident that we have changed this virus curve and the rate of infections. It has been because of proactivity on everybody's part, doing what they're asked to do. So I think for now, that's the biggest thing. Certainly we have, if people are still in the mood to make some masks or do some things like that, we have drop-off sites now at each one of our fire departments in our communities, like Toledo, North Lincoln Fire, Newport Fire. You know, everybody's accepting continued PPE donations, and we're making sure that we're sharing across the county. This isn't just coming to Samaritan. I don't want anybody to think that. Although we're the biggest entities, there's tons of doctors' offices and different folks out there, are public health people, you know, who are coming into contact with patients, and they need, you know, they need that PPE just as well. So we're trying to do things across the board, and we love that. When it's time for recovery, I think it's going to be just listening very carefully and you know, sort of obeying the new rules that come out, and making sure that we do it carefully and thoughtfully, so that we don't take a step back and we don't sacrifice people's lives while we're trying to get back to you know, some semblance of normal. And then we're just happy at some point it will be time to get back to business, and we're here, and we hope we're ready for everybody's demand, and we'll welcome everybody back with open arms. But in the meantime, if anybody needs health care, I encourage them to seek it, because we are being as safe as possible, you know, with all of our respiratory and non-respiratory patients. So really, I think it's just pulling together, just like we've done. Just keep doing it.
All right. Well, thank you so much. Thank you for your guidance, your leadership. We definitely appreciate you in Lincoln City and Newport. And
Thank you.
And also thank you for talking to us today, taking time out of your busy schedule. So thanks everybody for joining us today. This will also has been recorded and will be available on our website, and we'll share it on social media too. So if someone wasn't able to join us and you hear about that, direct them there. All right. Thank you. Go have a great day.
Thank you. Be safe.